So let's start with grateful patient philanthropy. As we sit here, a few years removed now from COVID, how do you think that things have shifted and changed in the way that healthcare organizations think about grateful patient philanthropy now?
We do have this conversation quite often. I find that post-pandemic responses, the way that I like to call it, that we know that there's a lot of gratitude, but we also know that during the pandemic response, the spotlight shone on many other important aspects of what healthcare can do. And the importance of inclusion of all aspects of your community and so on. So we know that gratitude is still important, and we want to be sure that for the process of healing for patients and families, and for the process of encouraging our caregivers and our clinician partners, that we want to still connect those and make that possible. So there's still that very important place where gratitude plays a role in connecting the families with the clinicians and then leading to philanthropy. But we also see that the pendulum is swinging just a little bit. And at one point, gratitude was such a big reason that people um, were partnering to give. And we see now that there are many more reasons that are coming out. And development teams need to understand how to engage donors in their passion, not only their gratitude.
Mhm. Absolutely. And I think too, we saw as healthcare was in the spotlight, it was elevated that the impact of philanthropy that can be had in healthcare. And I think that's what's incredibly rewarding and why I'm so excited about healthcare philanthropy is that direct connection, how it impacts lives every single day. And I think it elevated the opportunity and the need for philanthropy. And I think it also, as the COVID response was such a disruptor that it provided that opportunity for individuals to almost take that pause and be a part of respected people doing important work that perhaps wasn't seen in such an intense light. And the beautiful thing of that is, and what my favorite thing to think about with healthcare philanthropy is, there's obviously the direct benefit of raising money to fulfill your mission and to fuel the things that are important for better patient care and better qualities at our hospital, better access, whatever that might look like. But the secondary benefits that what we see in research that we knew before the COVID response, that we've read, that we've studied, that we've taught about physician burnout and stress and depression and just all the complexities and the pressures of healthcare environment, but the secondary benefits of the joy that engaging in philanthropy looks like. And so instead of, in the words of Mark McCampbell, that the Grateful Patient Program isn't just the flavor of the month or the initiative or the shiny object, but rather that it's seeped into the culture. And the best way that we define culture as a firm is it's the way we do things. And so the joy is when you hear that clinicians, that nurses, that health adjacent professionals, that the social worker, the child life specialist, the parking attendant, the janitor, the receptionist, the individuals on the C-suite, the board, that they all know how to respond to expressions of interest, of people asking about more around the hospital, whether it's gratitude, whether it's concern, whether it's just being inspired by saying, what's going on at the hospital? And that Mark, no matter what his role is, say you were connected, you're able to share that response. And that's what's so exciting. It sees we're starting to seep in to greater aspects of the full gamut of the hospital. And that's really exciting.
So when you think about culture, talk to me a little bit about that part. What are you seeing from our clients and partners? What are they really struggling on with the culture piece right now?
Well, I think about the time I was in Bangkok and I kept walking into traffic because I would come to a corner and look to the right and look or rather I would look to the left for the oncoming traffic on the right side. And in fact, the traffic was coming at me on the other side. And I realized that I was coming into a culture where no one woke up in the morning and had to think about which direction to look when they crossed the street. But I didn't know that because I was coming into a culture that that I didn't know and didn't understand. And so I think about that when we go into organizations where there is no culture for philanthropy, or it's a very immature culture for philanthropy, that it's maybe a point on the agenda, or it might be part of a manager meeting, or there might be a highlight, or the executive team might be asked to sponsor tables at the gala or participate in the golf tournament. In fact, when we really start to talk about culture, from the CEO of the health system on, everyone understands that what they have to do there is really create an experience where people will have good outcomes, where people will have high patient satisfaction scores, where there's a nursing environment that's effective in connecting with people compassionately. Those are the things that create a culture where philanthropy can happen. In other words, you can't have a grateful patient program if you don't have grateful patients. And so you have to work on your work. You have to work on the core work of the health system. And then the philanthropy team has to understand what that business is and that health system work is in order for them to be able to integrate integrate with it so that it's not an add-on and they're not asking for extra work. They're asking people to do their work and in their role participate in philanthropy.
I think about the shift for culture and change management and recognizing and acknowledging that that's very difficult. How do you create that shift? How do you get the buy-in that's necessary? And how does it become repeatable, that it's predictable, that it's the way we do things here, but it's also sustainable? That's not just led by one individual that was hired to implement a grateful patient program or to pursue better individual giving opportunities, but really doing the hard work to shift that. And that takes often that leadership buy-in. But it's also, that can be contingent on so many aspects that it's doing what you can do, right? It's not necessarily perfection or 100% adoption, if you will, but just thinking about what are the things that we can have influence over? How do we be strategic? How do we find those walls or those barriers, those obstacles as opportunities to be creative, to think about what does that look like here? And oftentimes I think when we think of culture shift, we want the formula or the easy way, but there's no, and my other markism is if you've seen one health system, you've seen one health system.
Mm-hmm.
And yes, we can learn from other peers and other organizations, other systems, and find some themes that were helpful, but it's acknowledging that everyone is at a different place in their level of understanding what philanthropy is, a level of prioritizing philanthropy, a level of, as you mentioned, their patient satisfaction scores or the various scorings or rankings that the healthcare organizations are having to adhere to,
Mm-hmm.
that really impacts the overall culture. But if you think of philanthropy, I'm even thinking about advancement resources shift from saying culture of philanthropy to culture for philanthropy.
Mm-hmm.
And that philanthropy could be the soul of the system, of the health care institution, in a way that it embodies every single aspect. And it brings back that meaning, but that drive and that lens to think, how do we feel this work in more meaningful ways?
I feel like it's important for philanthropy leaders, the chief especially, to begin to think of themselves as executives in healthcare rather than as philanthropy executive. And for them to understand how to speak CFO, they've got to understand the business. And when we have gone into organizations and talked to them about what we're doing in other places, that there's been a shift to a culture for philanthropy. It's been where the CFO can begin to start budgeting revenue from philanthropy as another payer strategy. Now, that's the way that you get the attention of the C-suite. We have to start thinking about it in a way that's going to make a meaningful impact. As one CEO told me, the money we're talking about is budget dust. And what we have to do is convert that thinking to looking at what it takes for that healthcare organization to get that much money to their bottom line and how philanthropy can increase that bottom line.
We were in a recent conversation with a CEO of a large health system, and you coined the phrase that philanthropy is
Is the healthcare a margin of the future?
Of the future, right? And we were joking that we need to brand that and put it on a coffee cup or a t-shirt, right? Just thinking about that reminder that they can recognize that this can be, a revenue stream and that this can be an integral part of thinking about the runnings of a hospital. And I think sometimes those frustrations is not acknowledging or understanding what's going on in that CEO's mind and the immense pressure and the complexities of healthcare where it's at right now, but seeing as philanthropy as that opportunity to provide that margin, to redeem it in a way, to provide that extra cushion, it really turns some heads. We all often think about when we think about return on philanthropic investment or stewardship, it's that reminder that the impact is so important, but that opportunity there is to spend the money, right? And so that's exactly what you were saying with that. How do we get those funds spent? And the joy is when organizations start to do that and it starts to get the attention of the C-suite. We're working closely with the health system and they had a lot of funds and they were able to start allocating that and giving spending those out. And it really got the attention of the C-suite.
Excellent. Thank you so much. I'm gonna ask you one more question. It's gonna be a difficult one. So the conversations we've had about the future of healthcare, thinking bigger, thinking like a healthcare executive instead of just the advancement, the fundraising part, and just elevating the thinking in general. As we think about moving beyond this and we push into these difficult areas, um, it's great for things that maybe people currently don't fundraise for, health equity, or you mentioned physician burnout earlier. Trying to get a donor to give specifically to that, to their organization. It is a shift and it's difficult. So let's say I were a chief development officer in a medium sized healthcare organization right now, 2024, and I just came to you and said, I want to do this. What would your advice be? Where do they start?
A starting place could be the recognition of what the real challenges in healthcare are, and to realize that there are 350 million people in the United States that are served by 1 million active physicians. And there's a huge shortage there. And that one of the problems with physicians is that because of that shortage, they're being stretched too thin and they're leaving practice and they're going away. And so I think a place to begin would be to talk about how are we creating the healthcare system of the future that will actually be a change in the way that we deliver and also a change in the way that we commit, that we change the health of our communities. And so for a development officer coming to us to think about how do we begin with that, I would want that person to go and have a conversation with their leadership team and understand what is the work that we are doing that might address these 4 or 5 things that can move the needle for healthcare in the future.
With that information too, I think that's when they can start getting creative to develop those compelling funding priorities, to think bigger and to really elevate the sights of having vision. And I believe, and I'm sure you believe, is that is one of the first pieces we have to have is having a strong, compelling vision to think bigger and to think beyond just the needs list or, where, the whatever that looks like, but rather focus on how do we dream? How do we change the face of healthcare? And how do we raise our sights to inspire individuals to want to be a part of the story, the thread that's happening? And so how do you take that information if you were to assess, that organization and you can recognize some of those pain points? What are those steps then to start thinking about managing up to develop those compelling funding parties beyond the same old?
I think helping people understand how to tell their story and articulate the work that they are doing that could make a difference and move that needle. So many organizations understand the work that they're doing from the how perspective, and they haven't backed up to the why. And so oftentimes when we'll begin to talk with people, we'll ask a School of Medicine dean, or we'll ask researchers, or we'll ask clinicians that are doing clinical research. Why do you need support? Why do you need philanthropy? And they'll tell us things like, I need a lab, or I need to attract talent. And so we try to back up with them and help them understand what we really need to be telling people is what's the societal impact of not doing this work that you need to do? And tell me what's going to make a difference in people's
That's
lives.
right.
And show me what the situation is like now. And then tell me the promise that you want to bring that will make a future that's better. And then we can talk about the how. But we have to capture people's interest. First of all, by telling them a why that's unacceptable, and then a promise that will change that future and make that better. And then now we can get into the how. They always want to start with the how.
That's right.
And that's good, but that's not going to capture people's interest.
So we'll often do this in whether it's a training environment, a working session, or even one-on-one. I'm thinking of a more coaching type format. Share a story of one of the researchers or deans
Mm,
or physicians that you've worked
mm,
with that they walked out with the light bulb. And these are some of the favorite things that I've seen you do is when I'll ask, "Hey, how did that go?" And you'll talk about the breakthrough or the amazing idea. And you've got one hand on your checkbook because you're so inspired. And then the other part is you're just so excited to see that light bulb turn on and think about what does that future state look like now that they have this opportunity to start to walk into that d- greater vision.
Yeah, this is very recently. I've talked about this with some people who were in an inner city situation
Mm,
where there were many communities where there were not only healthcare access issues, but there were people, families who no one had ever in that entire generations back had ever gone to college. They've never had the opportunity to take their dreams and move forward to do something that would come back and benefit that community. And so I asked, what's the impact of this? And the response we finally got to, after asking why so many times, was that we are losing that context. We are losing that understanding of these people and how we can work with our own communities. We're losing that when we don't have these people come in and design processes and programs and bring solutions for that
mm,
community. I think that's one of the big breakthroughs that I saw where they realized what they were trying to raise money for that started out was because we needed deans. And I just kept asking why? And it came down to because we actually need to change this community and rebalance it so that the people who are brilliant here come out of this, go through training, come back to that community, and it's changed forever.
mm,
As well as the family, the economy, everything else has been impacted.
mm.
But that's the societal impact. And that was the lights coming on. And then I pulled out my credit card and and I said, I'm ready to make a donation after they said it that way.
Beautiful. Thank you so much for sharing. What you just did, Caleb, where you elucidated a point and then asked Mark to tell a story about it, that's so good and so powerful. It's one of the great ways you guys work together. And I hope you'll join me with part two, where we'll talk a little bit more about that relationship. But for now, thank you so much for this conversation. It's been really great.